listening to iRadio, bringing you programs that offer you an in-depth look at the issues that affect you. iRadio, your eye on South Sudan.
The Dawn on iRadio.
Right, a very good morning to you and welcome to the third hour. It is the extended hour of the Dawn Show for today, and it's Friday the 17th of October 2025. My name is Emmanuel J Akile, and it's now coming to 12 minutes after the hour of 8. Now, in the third hour of the Dawn, we are going to talk about menstrual hygiene management, and menstruation is natural, yet for many in South Sudan, it's still surrounded by silence and stigma. So to understand the relevant information related to menstrual hygiene management, some challenges involved, create a positive mindset, attitudes, and positive behaviors toward menstrual hygiene management, and how men and boys can also actively contribute as allies to women and girls. I'm joined live in the studio by Dr. Idioro Juku, who is an obstetrician and also gynecological oncologist, and I'm also expecting Datagodon, the executive director of Men for Women organization, to join us later. He got stuck on his way here because of the court case which is ongoing there. But for now, it's good to have you with me, Dr. Idioro, in the studio. Welcome to iRadio. Good morning.
Good morning. Thank you so much for having me.
Yes. Now, let's start with some simple questions. And what does menstrual hygiene management really mean in simple terms, Doctor?
In simple terms, menstrual hygiene is practices and conditions that help women and girls manage their period safely, comfortably, and with dignity. Yani Arabic basit. Should I say in Arabic?
Of course,
yeah.
Yes, sure.
So that also our listeners can hear us. So the Arab basit menstrual hygiene yani مثلا دي حاجات النسوان وبنات بعملوا كانوا منين دورة تومون عادة دورة تومون كان فيه عشان مم بكون شنو مرتاحين وكمان شنو مم بأقدر اشتغل شغل تومون كويس.
دورة شهرية ده.
دورة شهرية.
And then why is it important, Doctor, to openly talk about menstruation in South Sudan?
It is really very important to talk about menstruation in South Sudan because people think menstruation is like they consider it a taboo when you talk about it. But again, when we talk about it, you know, the girls feel comfortable when they are having their menses, and they will be able to manage it also well. Because again, having a good menstrual hygiene, it involves having clean materials like pads. Now, a small girl who is just going to school, where does she get the money to have the pad, the sanitary pad? So she needs to talk about it, and someone, the parents or whoever the caregiver, should be able also to know what they need, and also this helps us to maintain cleanliness. Because if we speak openly about menstrual hygiene, you know, about menstruation, some girls will be hiding. Maybe they have the pads or whatever they have used. They will be hiding it in the house so that people don't see. So we really need to talk about it so that they know it is normal, and they also know how to dispose the pads, and then they have the good access to facilities. So with all this, they need to have that accurate knowledge, and they need to be aware about menstruation and menstrual hygiene.
وده بعربي بتقدر تزيدوا فوقه كمان للمستمعين يعني أهمية أنا بقدر ونس في موضوع دورة شهرية ده.
يا دورة شهرية ده يا جماعة ده حاجة طبيعية. So أنا لازم كده ونسو كلام ده برا عشان بنات تتنا بكون شنو مرتاحين وهم بقدر manage menstruation ده تومن كويس. يلا ده كمان بداري يعني مثلا زول بكون عنده pads عشان بيستعمل كل شهر so كان بيجا كلام ده ما جدده يعني زول بيدوسو او بيجاوري كيف لزول المسؤول قالي انا دير بات انا دير always they are common لناس use او ما بقدر ونسو قالي او دير always so يلا كمان مثلا كانوا حاجه لوج يوز كان ده قماش ولا كان شنو كانوا يوز عشان ما دير كده ناس عارفوا او برجع ده وين so it becomes also an environmental issue so عشان كده انا دير توعيه لناس كله كده عارف قالي menstrual عادة الشهرية ده وحاجة طبيعية في حياة نسوان وبنات.
And also we want you to explain what happens during menstruation from a health perspective, doctor.
During menstruation there is hormonal changes. Actually menstruation is the end result of so many physiological changes that have gone through the body, starting from the brain, releasing hormones from the brain, the pituitary gland in the brain, that also goes to the ovaries, and then at the end of it, we have the menstruation, which is now the flow of blood outside of the uterus. So, and during menstruation, there is a lot of challenges that happen with girls and women. For example, the hormones actually cause them to get emotional. Sometimes somebody doesn't want to talk. Yeah, and then people don't understand why they are not they are not talking. And people feel sometimes they are rude. You know, it brings a lot of conflicts in the house, or even they start refusing going to school, and sometimes they get pain, this menstrual pain. Then you are being told these cramps are normal. You know, this once the pain is so severe, it is never normal. So sometimes girls are being told to just keep quiet and withstand the pain, which is really not a normal thing. So, yeah.
How would you advise? And if sometimes, don't you think some of them can take painkiller or medicine? Is there any medication to at least reduce the pain, or they have to endure every month?
No, there are medications. So if the pain is severe, they are supposed to be taken to a gynecologist. So the pain is supposed to be managed. And sometimes with the severe pain, that means there are some other things which are happening, like maybe they are having endometriosis, which is also nowadays common, or even polycystic ovary syndrome also comes along with a lot of menstrual pain. So if a girl complains of severe pain, which we call dysmenorrhea, during the period, they are supposed to be attended to by a gynecologist. Yeah.
And this issue of menstruation, a layman out there might be wondering to understand what age bracket are we talking about here? When does it start and when does it end?
Menstruation nowadays, this is the period where we call adolescence, and then menstruation come. You know, it depends. Nowadays, we can even get girls menstruating from the age of 9 years. It all depends on the growth. Yes, the faster they grow, you know, the faster they reach adolescence age, and they can get their menses. So we have we have girls even getting their menses from the age of 9. But this is the age of adolescence, 9 to 18 years there. Yeah.
Right. And also, are there some common myths and misconceptions about menstruation? And then how do they really affect girls and women, Dr. Iduru?
The common myths are there. But I just want to give a shout out to some of the women and girls that I've taken them through some sessions. My women in Mangala, my women in Kondokoro and Rajaf. So I think we had some sessions and where we brought women and girls together with their daughters or their caregivers. So we brought them together and we talked to them, and the girls were able to appreciate that their mothers are actually listening firsthand from the doctor what needed to be done to them. and even the women were very happy that such sessions were conducted to them, and they were very happy, and they knew what can be done, what they should do to their girls. So we have some myths like menstruation is dirty or impure. I always ask my people, South Sudanese, you say menstruation is dirty and impure. So when at some point when the girl gets married, you are expecting the girl to give birth. How can a girl give birth without having their periods? So these are stages in life where the girl should undergo, and it should be considered normal. So we have other myths like girls should not bathe in some cultures or wash their hair during menstruation. This is wrong. We are advocating for menstrual hygiene. During menses, they are supposed to be clean and maintain standard hygiene. So eating certain foods, girls are being
Prevented or prohibited
prohibited from eating certain foods. You are not supposed to eat fruits, or you are not supposed to eat eggs or fish. Unless they have allergies to those ones, they are not supposed to eat it. But medically or scientifically, there is no proven foods that are not supposed to be eaten by girls. And then again, you should not talk about menstruation openly. Again, I want to give a shout out to also some of the pupils, primary school pupils in Gudele West and Luri Rokwe. So I think I brought all the girls and the boys together in a class, and we talked about menstruation, and they were very happy. And the boys were there, and they said, we are the ones who are going to defend them in school. We are the ones going to make sure the toilets are clean. Yeah, so that they come to school and they are able to manage their menstruation, because they need to change. To maintain them in school, maybe you need to go and change your part every 2 hours or 3 hours, so you cannot go home and then come back to school. So the boys actually were very happy, and they said we are the ones going to help them in having the washrooms clean.
Right.
So again, girls should not do exercise during menstruation. Exercises are allowed. So unless maybe they are having heavy periods or the pains are too much, then it's something which is allowed. So again, in certain cultures, when a girl is having menstruation, she's not supposed to cook, or she's not supposed to go to religious places. I think this is a stigmatization, which we actually don't want, and we need to prevent that. So we need to encourage our girls to do whatever activities they are able to do,
Right.
even during their menses.
Right. And do you think there are some challenges women and girls face in managing their menstruation? I mean, you mentioned some of them earlier, but then, for example, access to pads, the issue of water, sanitation, stigma, among many others?
Yes, there are a lot of challenges. Again, I'm sorry, but I will bring what I know on the ground.
Sure.
One of the schools I went to, and we were talking about menstrual hygiene and how the washroom should be clean so that the girls are comfortably using them and changing. And the issue which was raised, the washrooms are there, we get water, but the community around use the same school washrooms. Even if it is locked, they come and break. So I will tell my community people, please make your own latrines in your houses. Stop using school's washroom, because we really need these girls to be in school. So if you are the ones who are making the school toilets dirty, so how do you want your daughter to be in school the whole day? So these are some of the challenges, because now you cannot change access to water and access to pads. But some organizations have actually done well, and most of the schools I went to, there are actually pads in their offices. So the head woman teacher always there have pads in her office. So the girls who don't have pads are supposed to access those parts.
Right. Can you say that بالعربي especially موضوع رسالتك للمجتمع في ناحية المدارس المرات بيقرا كسروا حمام تاع مدرسة وبيستعملوه وكمان نفسه يالتو من دي أمون دير كده يروح لمدارس يعني رسالتك بقدر زيدوا كيف بالعربي للمجتمع برا هناك.
مجتمعاتنا في جنوب السودان especially في جوجوبيني itakuwa قاعدين قريب بمدارس. معلش انا باسا دي تكونينو كده itakuwa amolo bakana takun في بيوت takun كلام ابو ناس ديرو استعمل bakana تا مدرسة يلا إشالا كان مدرسين غوفولو itakuwa بيجا itakuwa بكاسورو itakuwa بواسكانو bakana de kutu hinak da amolo عشان أنا دير يالتا تانا كده زمن ألومون في مدرسة ده كدوم نكون مرتاحين في مدرسة especially banatana في مدرسة كانوا منيندو ada shahria tatomon kodomon kun fi fesil kodomon kunindu mahala almo baki de roa gairu fogo lakini bakana debe akan wasaka bidaka alfogo kef so ajade kulu are connected so everyone has a role. The community has a role, the teachers have a role. But now if the community are the ones sending girls to school and then on the other hand they are the ones who are making the toilets dirty, I think we are contradicting here.
Yeah.
So I will still tell our community leaders who are around schools to make sure the schools' toilets are not used by the community around.
No.
Let it be left for the school.
وانت بتكلم شنو في موضوع الخرافات او مفاهيم الخاطئه misconception ده موضوع وصمه العار ووصول بتاع حصول للمويه وكمان الصحه والمياه وكمان الادوات اللي بيستخدموا يعني هل انت بتعتقد انه ده واحد من التحديات وكيف ممكن مثلا المجتمع والسوسايتي وكمان برضه البارتنرز يقدر يساعدوا عشان يقدر يعملوا سبورت للبنات من الناحيه دي؟
Yeah, I think I will tell our partners and communities, all the NGOs who are in support of initiatives for keeping girls in school. I think this is one most important thing. We need to provide them with water. We need to provide them with... but most of the schools I went to, they have good toilets. So I think maintaining the hygiene, maintaining the cleanliness of the toilet is where we have a problem. And provision of sanitary pads also. And kamana na bikelim le mujtama tatana. Yani masalan, most of the time nuswan men dum shogol, nuswan del gaidin fi biyut, housewives. Rajil bija bitala gurush bes gali de tamola lela. Ya jameta kantala asharalde ma bijibu fogo ajire. Ma bijibu fogo pat. So masalan rujal dana kama body message le rujal de. Itan kango di gurush sama sarif de wodi fogo gurush ziyada shan bakira jibu bo pat. Yeah.
And then how does lack of menstrual products now affect school attendance and daily participation? Do you think it has some impact?
It definitely has a lot of impact. Because now if I don't have the sanitary pad, how do I go to school? How do I stay the whole day in school? So, and missing school, again, you will not be able to catch up easily. So school absenteeism increases. Yeah, so I think provision of pads and provision of the sanitary facilities is really very important to keep the girls in school. And again, if it happens many times, definitely the girl will end up dropping out. And again, in our midst, one of the myths people say, kan binede kalas balik manatu shunu o jahis le jozo kede jozo. So absenting yourself from the girl absenting herself from school, then that encourages even the parents or the caregiver to give you out. So I think we also need to balance these attitudes.
Right. And Dr. Idioro, then do you think some cultural beliefs or taboos really shape how menstruation is perceived? You earlier talked about you mentioned some of the cultural taboos, but do you think they at some point shape the how menstruation is perceived, the cultures? Yeah,
the culture, our cultures, most of the cultures actually influence attitudes and behavior and the way menstrual health is discussed. you know, once you don't discuss it, you are not open about it, you don't have access to the pads. Now, if like your father perceives menstruation as something which is not good, so how do you go and tell him that I'm having pain, a period pain, and I need to go and see the doctor? How do you then go and tell him that I'm having periods, I need pads? So it becomes also a challenge. So this actually leads to silencing of the women within the community, because once you don't discuss, then you are supposed to keep quiet. And then again, I will go back to our patriarchal system where our resources are being controlled by men who give least attention to menstrual products. So again, here is where we have a problem. And then value for menstruation is value for fertility and purity. So this encourages also early marriage. So once they're having their periods, that one now encourages the family or the community to give the girl out for early marriage. Yeah,
right.
And this is some sort of gender discrimination.
Right.
Yeah.
And then what role then can men and boys play in breaking the stigma and also supporting menstrual health?
I think we need awareness. Yes, boys and girls need to be aware of management of menstruation and menstrual hygiene and their role in it. I will still give an example of the schools that I went to where I brought in the boys. The boys are very supportive. Yes. And so once we involve them, they are actually the ones who encourage now the girls, because I always ask them the question, do you want to shame how will you feel if your sister is being shamed because of period? They said very bad. So I said, okay, now these girls are also like your sisters. As much as you don't want your sister to be ashamed because of menstruation, so also you protect your colleagues in school. So once you see someone having periods, you are the ones who even to support them and show them where maybe they don't know that the head woman teacher has the pads. So you are the ones to show them. So in engaging boys and men actually helps the society to be aware and bring menstruation as something which is normal and to be accepted.
Right. ده بيجيبنا ل 33 دقيقة بعد الساعة 8 في استديوهات اي راديو. ده الوقت اللي فيه نرفع المكالمات لتعليقات بتاعك. بنتكلم في موضوع بتاعت إدارة النظافة الصحية أثناء الدورة الشهرية، واللقاء الحصري أو الخاص ده بيجيك بدعم من GIZ. وطبعا الدورة الشهرية ده أمر طبيعي، إلا أنه لا تزال بالنسبة لكثير في جنوب السودان ده محاطة بالصمت والوصمة، وكمان لفهم المعلومات المهمة والمتعلقة بإدارة النظافة الصحية. ضيف بتاعنا في الاستوديو هي الدكتورة إديورو اللي حتجاوب لبعض من الأسئلة بتاعك. I radio, good morning. Yes.
good morning to you. Emmanuel J Akile.
نعم.
أيوة البرنامج جميل شديد. ده 1984 في جبل.
1984 from جبل. تفضل واصل.
كلام ما نقول نسير كلام ده كله بيجي لبعضه. لو نسيان ده يقول نسير طريقة ده طريقة تمام ده. لكن هاي بعمل و كده. ده هو جماعي. ده شنو كده ده ما يا كلام اللي بيشاهد دونات. ده يا شيكا. كلام ده شيء نزيد. مين يبدر؟ ada baja del monse nay bade ba na jere gida wonda yal fikirin get down keda kan der bodi rejado dinia bigede sirin tena wala sirin tena dolin tena bija jojo karanta kan bodi fi laki jaman ta asa de biga ya aje kulu karabo so de kalam ko jemil so ana ma sol aja na aja mara de balin ta aja beton ya aja fo baden yani amutamar kullu lajin kare a giso ko fene ade de ya waja lu ko kala bido wonu ke de ma batala wala do banat yani mon ku yani gita on ma badul de so kera ko para se la dara cha wala fi ato te monasha ba mon gita on ma badul to aja na dira gido to ye monaja mata la ja gido del ale kale ke sa ada banat la dara ja de yani se aja na jano ma ko yani banat gale ya ga mulo mon support de gara mon bido tu mi yan يعني يال ولا ربنا إذا ما تكشمون أبو كيل مسا أبو ما كيل مسا مثلا في مدرسة كمان كمسارة جيبو أولا ده بودي وبنا ده بودي يعني ممكن متى مساعدة ممكن من ده كمان جيزما أو ده كمان بيولو قماش أو ده رام ملو شراب أجا ده كله كلام ملو يقال و ركيد كمان قرأ قرأنا مارو كذا
1994 رصيد كرة قطع كلام تا رصيد ده مشكلة اقتصاد ده بعملوا كيف لكن نعرف بعد من نقاط كده أهمية يكون في equality و treatment NGOs أو partners يكون بالتساوي بين بنات وأولاد أهمية موضوع awareness موضوع early and forced marriage ونقاط تاني إذا نرفع 2-3 مكالمات تاني قبل ما نرجع للجست بتاعنا في الاستوديو عشان تجاوب للأسئلة. You can dial 0911-986-986 or 22-986-986. We are talking about menstrual hygiene management. Remember, we're also live on our Facebook page. You can drop your comment there. Radio.
Hello, Radio.
Yes. منو معنا؟
نعم يوانس بن ياكورين.
يوانس بن ياكورين، تفضل.
بالنسبة للسؤال على شوية عن الحاجات الموجودة الجديدة للبنات. هلو.
واصل طوالي سؤالك.
السؤال بس على إنه من الزمان داري ساتو الفيا البنات في كل زمن. إنه البنات كل وقت داري ساتو هل في نجاة على بنات كل وقت من ساتو على تهرم على حياة بتاعهم. من الزمان داري دي إقدام. ولو قاعدين جزء منه يقدرون تجيتهم وما قدر يكمل تعليمه ويمشي لقدام.
alright سؤال يبدو شوية بعيد من الموضوع بتاعنا لكن برضو ممكن يجاوبوا أو يعلقوا عليه موضوع بتاع إنه even though we see partners in let's say NGOs supporting girls, but do you see the results, the positive results of the support? As we wait for more calls, let's read this comment here from Riak Kwet on our Facebook, Dr. Idioro. He said, the ancient knowledge taught us about the divinity of masculinity. They carry the portal or gateway that brings the spirit being to come into the third dimension, which is the earth. And then he's saying menstrual of women and or girls is natural. When it happens, then be aware that they align with source of power, which is creation or the creation of the field. It is not clear this part. Let's continue. You say, we were advised to stay away when menstrual come, and we should honor them, respect them on the situation, peace and love. Talking about respect when it comes to the issue of menstruation. You can note that down, Doctor. Let's pick one or two calls, 0911 or 22-986-986 or 0913-986-986. ده ممكن ترسل رسالة بتاعك أو برضو ممكن تقدم تعليقك على الفيسبوك page.
Of a new dawn, and this is the dawn on iRadio.
iRadio, your eye on South Sudan. iRadio, your eye on South Sudan. iRadio.
Yes, another message here on our Facebook from Gismala Isaac, and he's saying it's lack of sanitary pads and menstrual education that cause silence and stigma in our communities. Most girls, including our own wives, still use outdated method of keeping themselves clean. Thus, use of blanket, dirty clothes, several months of using reusable parts and dirty cotton, etc. And he's saying, when I interacted with some women, they indeed feel ashamed to move out during their periods in a fear that it will stain their clothes due to poor methods they use for keeping themselves clean. All these blames goes to our leaders. Imagine a family that hardly puts food on the table for their children. How about menstrual kits? Very important points there raised by Gismala Isaac. Dr. Idoro, we have 20 minutes to conclude our interview. You have a number of questions and comments. It's now your turn to respond or comment. تفضلي. انت داير جزء بعربي جزء بانجليزي تبغى واصل كمان.
شكرا. أنا بس داير Shukran takon kaman nasal who are following us. We really thank you so much, because without you we wouldn't have been here. Now caller number 1, I forgot your name. Lakin itagali
1984.
1984.
It is in
Yeah, 1984. I think kalam tataki kan kwais shedid. Ita kana soma min bidaya ana keni mgalifini ana wakit geni amolo sessions atay ana jibu banat wa awlad kulu sawa. So anna der osulu banat ma awlad kede jibu sawa, wa kan fe ya haja gamolo, yani fi wahid min madaris alana futu fogo failan awlad de kaman reis nifsa kalam. Mon ke ngali nas bes kulu gija hina o aya haja gija bule banat de part. So next time kan nas gija kede jibulo mon boxers. So ana kaman reis de be nasal gi support project de wana werilo mongali next time kan nas gura kaman kede shilu hajat le awlad the boxers. So we have to treat them together. You are right there. And Johannes, yeah, support al gamulule banade, it is actually having positive impact, because we are seeing more girls in school and they are even able to talk about it openly. Yani one of the schools I went, and when they came in, even the boys and the girls together, and they called themselves and they told me, now we are the legends. We have come, so you are dealing with legends. We know everything. So we started talking, and they were very, very, very okay. And you could not even say these are primary school pupils who are talking like that, but they were all very free, both boys and girls. So it actually have positive changes, and even the boys were saying, because I told them, when we keep the girls in school, we will prevent early marriage, and we will prevent these teenage pregnancies. And even these same girls, when you marry them in future, they will be the very much supportive wives that you will have. So you will not be the husband who is working alone and giving support alone. So your wife will also be supporting. And they were very happy with that narrative. Right. Then Facebook, one advice to stay away. Yeah, we need to respect girls, not necessarily staying away, but give them their space when they need it. Because sometimes with the hormones and the cramps, maybe they don't want to talk and they don't want to interact. Give them that space. So I will really support you to give them their space and with their respect, so that they also have their dignity. Now, Gismala, you are talking, I think your response was well, because actually, basically, this is due to lack of awareness. If we are aware, we will act differently. So lack of awareness is our problem, and that is why we are here today in the studio, so that everyone knows that this is something which is natural, which is normal, and we need to talk about it, and we need to support our women and girls. So why women fear going out during their menses? Yeah, because of lack of these good sanitary towels that they are supposed to use. And I think all the people who have responded, if I'm not wrong, including our callers, they are all men. I don't know why our women are our women are quiet. But I'm encouraging all these men, even if you don't have a girl at home, kindly, whenever you go shopping, even if you sukasto mini, just be wahitajere, always major. Wodile ai binyata medersa bita digo fisika. Wala besita biu kan bat kamsha harkida kambuka wasulu kamsa wala ashara. Rafi mederesa bes wodile ustaza. We have senior women woman teacher. So we can also encourage this way, and even you go to for your shopping, you buy some parts. At the end of the month, you take them and drop them in any school near you. Yeah, that one will also help us together as community and society to keep our girls in school.
Right. And Gismala kamano zekir fi moduta families kaman moduta maisha, yani marabi kun saple usar shan magdar wafiru احتياجات بنات تومون بنات في حتى ناس جاسف عشان بيلقوا اكل ساكت يوم يلا موضوع تاع سنتاري بارتس كمان ممكن يكون تحدي تبغى شنو في الموضوع ده
موضوع ده صعب شويه لكن عشان كده انا again encourage اي زول who is able just buy some parts and then you take them. And also our organizations who are dealing with women and girls or education, Ministry of Education, I think we need every now and then to do some fundraising and get some parts and supply in schools So this will also encourage the girls who are not going to school. At least if I go to school, I will get my part from there. Yeah, I think this is also how we can balance to get all our girls in schools.
Right. And from your view, do you see there are some government policies or programs addressing menstrual hygiene?
Yes, we have some government policies through the Ministry of Education and partners on menstrual hygiene strategy. So in collaboration with the Ministry of Health, so we have something in place. Yeah, through the Ministry of Education.
Right. And then also, what more do you think should school or health workers do to improve access to information and also products of their menstruation?
Yeah, I think consideration that menstruation is normal. This is one thing, and we need to have everyone be aware that menstruation happens, and we all have to consider it as a normal thing. And then through the Ministry of Health, maybe also Department of Reproductive Health and Adolescent Health, maybe we need to have also leaflets that can be distributed for awareness purposes. And we also need to, maybe if resources are there, we need to have well menstrual hygiene day celebration, whereby we have T-shirts and we have talk shows. So I think this one also will raise more awareness on menstruation. Yeah.
يعني موضوع كمان بتاعت يعني دائما الناس كي قال الناس قونس كلام يركز مثلا في عاصمة جوبا هنا وفي بعض من مناطق الكبير لكن what about the remote areas the rural areas المرات يعني access لهم عشان بيلقوا حاجات ذاته في زول برا في الدكان كان في فيلج وين هناك بيلقوا ميداد أو sanitary pad بيكون صعب. So كيف بقدر أعمل لهم منتوي عشان معلومات ده كله بيوصل لكل أمهات وبنات كمان في أباء في وأولاد في مناطق rural areas?
Yeah, I think it's a common problem everywhere, not only in terms of menstrual hygiene. Access to health care in general also is a problem due to lack of good infrastructure. There are no roads. So access to health facilities, it becomes a problem. So I think in terms, when we go to our government, we need to encourage our government to also improve road infrastructure, so that we are our women in rural areas are able to access these facilities. But also through this radio talk show, I think it is also good for them to listen and hear. So we also need to have this mobile, we call it mobile clinics, yes, which we can also use for awareness. In the rural areas. Right.
We have about 12 minutes to wind up. It's good that we have Data Gordon here, Executive Director, Men for Women Organization. Thank you for joining us. Finally, you've made it. Idoro is tired of talking. She's been waiting for you to come and also say something, right?
Me, I'm a daughter of a teacher, and I'm also a teacher. I teach.
So you're not tired of...
I'm not tired. I can talk.
All right. Very interesting. It's good to have you with us, Data. Welcome.
Thank you so much.
Briefly, we want you also to talk about, when you came, I was asking Dr. Idoro about the policies that the government has in place or it should put in place to ensure that we continue to talk about the importance of menstrual hygiene management. What do you make of that?
Thank you so much. I think, first of all, I just want to bring in to the attention of the listeners, in 2019, November 12th to 14th, there was the Nairobi Summit on ICPD, that is International Conference on Population and Development. And at that time, the government, by then the first Vice President, His Excellency General Taban Dengai, on behalf of the government, made national commitments, and those commitments were very broad. But to be specific, one of the national commitments which was made was to provide free sanitary pads for all menstruating school girls in South Sudan, and that was to be immediately done. And I remember that commitment was read during the Nairobi Summit by the current Right Honorable Speaker, that is Emmanuel J, as he was then the Minister of Gender, Child and Social Welfare at that time. And we also had a delegation which was led by youth leaders, where I was part of it, and of course members of parliament from especially the Parliamentary Network on Population and Development, which was also there during that particular International Conference on Population and Development. So those are key commitments that were made by the government, and for me it's that if we made a commitment, why can't we actualize these commitments? That is one. Secondly, there is, of course, the Menstrual Health Management Coalition, which was formed. Of course, it is under the National Ministry of General Education and Instructions. And this coalition is led by the Secretariat, AFRIAN South Sudan. And it's doing a lot of engagement, working to make sure that things are put in place. And I remember they developed guidelines on dignity kits, reusable sanitary pads guidelines. If you're to make reusable sanitary pads, what are the guidelines to follow? So those are key things. And I think one other policy that is missing is the MHM policy, the menstrual health management policy. It is seriously missing. We have countries like, for example, Kenya, that has an MHM policy, and it guides all interventions around menstrual hygiene management. So these are also key things that happens. And also remember, during the Nairobi summit, one of the commitments, the national commitments made by the government was on a tax exemption on sanitary products. And since the commitments were made, and then, of course, COVID came in, we've been engaging with the different stakeholders from the National Ministry of Gender, Child and Social Welfare, from Parliament, even National Revenue Authority, and among other stakeholders to make sure that at least we have these taxes exempted on sanitary products. But, of course, there is that belief that if we tax this, the government talked about we are now reliant mostly. Remember, there was a time where we couldn't have the oil supplies was cut, and then the government is relying entirely on non-oil revenue. So that was also another fear. But of course, we are like, you cannot trade the aspect of fear because of the taxes of the non-oil revenue, and yet we are talking about at least more than 50% of the population. And when we talk about reproductive health age, most women and girls, of course, when they drop out of school, especially in school, because of lack of sanitary products, when they are stigmatized, you have 3-4 days you miss school, and there are subjects, for example, mathematics, science subjects, if you miss them, it is hard to recover. At least art subjects you can read and then you can be able to contextualize. But chemistry, physics, biology, it is hard for it to recover. So that is something that we are looking at, the aspect of why can't we exempt taxes on sanitary products, but why can't we also promote local production of sanitary products? So these are key things that I think for me, the government should be able to put in place so that we have a conducive environment that supports both menstruating girls in school, but also support menstruating women that are also at home to be able to access sanitary products quite easily and very affordable. And of course, it is accessible to everyone.
And briefly, Doctor, do you often receive families bringing their daughters or girls with some complications due to menstruation, or it rarely happens?
No, it is there, and actually, it is very common now, and nowadays because of accessibility, like in town here in Juba. So, and most of our girls now are Gen Zs, by the way, and they know, they Google, they will even come to you and tell you the diagnosis before even before even they tell you what is happening. Yes, yeah, our girls are ready to seek medical attention, so they just need to be supported, and they have more knowledge. Right. So we are getting many of them, and they really appreciate the services of gynecologists, because now when you give them the medication and you tell them, once you have the menses, you get the cramps, you start taking these medications, and for 3 days, once it is over, you stop. They are really very happy. They can even stay for 6 months, and then they stop it on their own, and they will come and call back and say, Diktor anak kalas dawa dana kan wo give yala ya matal futu de kaman kan jede de waja de mafi. So asede kedana rijabula wala kedana mabula. So they are really very good, and they are the best patients to deal with. Or maybe I say clients. They are the best clients to deal with.
They make your life easier.
They make life very easy, because they Google, and they know everything. They come to you with the diagnosis, then you start taking the history, and you agree that now the diagnosis you went to is not the right one, So we go with this diagnosis first. We treat and then we see.
Right.
Yeah.
And Data, how effective can role of men and boys be to ensure that they also support girls during their time of menstruation? Doctor earlier talked about parents, especially men, when they are giving masarif at home, for instance, they should also consider their daughters. The money should be added a little bit so that they can have sanitary pads. But what generally, how effective do you think the role of men and boys can be in terms of supporting girls?
Men have a very great role to play in terms of promoting menstrual hygiene management at home, but also in institutions. And she has highlighted the aspect of being at home, not just masarif, but also menstrual appropriate toilets is very important, because you find that I've talked about this. If you're building a house, mostly we like to invite the women to tell us how the kitchen should look like, right? But we don't ask them how the toilets should be like, right? But so in that context, our toilets must be menstrual appropriate. That is one. Secondly is men are mostly stigmatizers when it comes to issues of menstruation. So if we change from being stigmatizers to supporters, to allies, then that definitely means we'll be able to promote menstrual hygiene management and we'll be able to retain girls in school. The other aspect that I want to highlight, and she has been talking about it, menstrual cramps, endometriosis, and all those stuff, is that, and I want to bring it to the context that in institutions of learning, you find that most of these high institutions, not just of learning, but even in offices, men are the ones mostly at the top level. They are the ones leading these institutions. And we have either staff or these menstruating girls who have severe cramps that at least once a month they will want to go home. They need to be given some rest, right? And I remember in my previous work is that I had a colleague staff, when she just tells me once a month, she comes and says, I'm not feeling well, I just tell her go home. Because I knew, she had discussed this with me because I was quite open with all of them. I knew her cramps are so severe that it puts her down. So I just tell her go home, seek medical attention, and when you're okay, you come back. You don't need to apply for a leave. You don't need to write anything. Just come openly and tell me I'm going home. I do not even want to ask you anything in terms of what exactly it's all about. So if we're able to provide such an environment to not only girls in school, but also menstruating women who are in the offices. Because if she's not comfortable in the office, she's going through a lot of pain. Why do I have to keep her in the office? She needs to go and have some rest. If you also have a modern office where you have someone can rest, why not? If not, this person should be able to be given that particular room, go and rest. If you feel you're okay, you can come. But if you feel you're not okay, please proceed home. So that is something that for me, I think as men, we should go beyond. We should be able to discuss this. We should not only limit the discussions to women, the mothers discussing with the daughters, but as men, we should also be able to discuss with our girls. That way, they will feel more comfortable to open up to us, not only on issues of menstruation, but also other life issues.
All right.
Yeah.
We have about 2 or 3 minutes to wind up. Let me give you each 1 minute for your last message. Data, let me start with you. Your message, something that you want to give out there, especially to young girls who are listening, about managing menstruation with dignity.
Menstruation is a normal biological body change that happens in a woman's body. Menstruation is never a sickness, never dirty, never anything. If menstruation is dirty, then we are a product of a mystic period. All of us, then we are dirty, right? So it's important that open up, speak up. When you speak up, definitely you enlighten some of the men who have grown up and they did not learn anything about menstruation, and they get to understand. So engage within your peers, not only the girls, but also empower the boy child within you. You have siblings, let them know that to speak about menstruation is a normal thing that happens in our lives. So cultures should not control how we talk about menstruation, because it's a normal biological body change in a woman's body. Just like we have wet dreams. Yeah.
All right. Yes, Dr. Idioro.
Yeah, I think my last message goes differently, and I'll call out to all offices where you have your toilets. The female toilets should have that disposable menstrual pads disposal facilities, which are missing in every office that I went to.
They don't have
Most of them, just the dustbin with a paper bag in it. I think that one will also encourage women to be at work. And then to the cleaners in the offices, please, these are some things that are supposed to be managed. Don't start fighting the women in the office. Why are you bringing your dirt here? It is not that. It is part of the work. We have to manage them well. And to Ministry of Environment, let us improve on our waste disposal. Yeah. You are doing a good job, but still we have a room for improvement.
Right.
Yeah, thank you.
Right. Thank you very much, Dr. Idioro Ojukwu, obstetrician and gynecological oncologist, and Data Gordon, Executive Director, Men for Women Organization. Thank you both for joining us on the Dawn today.
You're welcome.
Right, and that brings us to the end of the extended hour of the Dawn edition for today. Do join us again on Monday at the same time to get the latest on what's happening in South Sudan and beyond the borders. Up next, Soundtrack Show with Dico DeAndrew on behalf of the Dawn team. Geoffrey Amanya Darlington Moses and producer Dico DeAndrew. My name is Emmanuel Joseph Akile. Have a great weekend. Stay safe, stay blessed. We meet again on Monday. I'll leave you with a song and Child Marriage coming to you from DJ Cent.